Welcome to Fuller Butz, a behind-the-scenes plastic surgery podcast. Yes, you heard that right. Join your co-hosts, Dr. Sam Fuller and Dr. Dan Butz, board-certified plastic and reconstructive surgeons, on an exclusive full-access pass into the world of plastic surgery. Combining their expertise and training, Drs. Fuller and Butz will share medical insights, detailed explanations, and lighthearted humor to keep you entertained and informed. We're certain you'll become passionate about the plastic surgery specialty, and between debunking myths, uncovering truths, or just making you laugh out loud at their perspective on this creative and artistic field, we've got something for everyone. From tummy tucks to Botox and mommy makeovers to surgery do-overs, the Fuller Butz Podcast will surely satisfy your podcast fix. All right, now let's dive into this episode.
Hey guys, welcome back to the Fuller Butz Podcast. I'm Dr. Fuller here with Dr. Butz. Dan, how are you doing this week?
I'm good. It's been beautiful outside. Summer's right around the corner. Excited for a nice hot weekend. You have any big plans?
Yeah,
Baseball?
but I want to hear about the heart surgery on the pig. How did that go?
Man, the kids had a blast. I mean, it was like they're kind of grossed out, and they obviously we gowned them up, gloves and whatnot, and just did a little video didactic session to kind of go through the basics and let them cut open the different ventricles, look at the various components, and I think they all really enjoyed it. Awesome. I even learned a few things, refreshed my anatomy lessons a little bit. Haven't been in the heart in a while, fortunately.
I picked up and am surprising my kids with a slip and slide from Costco this weekend. So as long as the weather continues to be beautiful, we are going to do some dunking, diving, dodging, and splashing around. So that should be good.
Do you see a lot of distal radius fractures from those?
Not slip and slides, man.
It's on grass. It's soft enough.
Yeah, it's all good. I did treat a guinea pig bite last week, though, so I am really going into
all the animals.
So I'm going to do a case series, I think, on just
you need a textbook.
And so today is our second portion of the extremities for body contouring. Last week we dived into and really glossed over some of the brachioplasty or arm lift hot topic or key points. Dan, do you want to just summarize or clarify like the take-home points from an arm lift perspective?
Yeah, we talked about non-surgical options or just liposuction kind of being patients who have minor laxity, but mostly are concerned with the fullness versus, more dramatic arm lift surgery for patients that have a lot of loose skin, which almost always incorporates some liposuction as well. It can really make really dramatic, improvements in how their arm contour is, how confident they feel in, short shirts, and really enable them to kind of let their arms be free. And
I would say that is going to be a similar theme to what we're going to be talking about this podcast on thigh lifts or thigh procedures, because there's kind of the good, the bad, the ugly. There's patients who just need a little bit removed or a little bit tightened, either on their inner thigh, their outer thigh, and to patients who've lost 200 pounds and they just have all this excess skin fat across their thighs that they are trying to hide with compression, that they are dissatisfied with, that they want removed. So it's really the full gamut of options. Dan, how do you approach thigh lift consultations, or where should we start with?
Yeah, thighs are a little different than the arm in that we're often treating more regions. So, right, normally in the arm, we're kind of focused on that underarm area. We don't do too much lipo or skin removal kind of on the outer side of it. But with the thighs, there's often the dreaded saddlebag deformity, the inner thigh, the posterior thigh with drooping of the butt. So there's a kind of more regions and kind of different options. But yeah, for patients who similarly just have fullness but good skin tone, liposuction can be a good option for contour, especially those saddlebags. You can really change someone's overall shape and contour pretty dramatically if they have that kind of really genetic disposition to carry weight there by just improving that contour. The inner thighs, I often talk about kind of shaving it down a little bit, tend not to be too as aggressive there. Then when you get into more big weight loss, dramatic skin laxity changes, then we're looking at more skin excision. Didn't you excise? You were telling me about some outer thigh lift you did recently?
Yeah, there's the full gamut of, minor liposuction, inner or outer. There's the excision of skin. And then just recently, we talked offline, I did a patient who had lost a considerable amount of weight, but still had that sort of metabolic, hard to lose fat, almost like a lipoma, almost like just globules of fat that were still residual or still in the saddlebag or the lateral outer thigh area. And so after doing liposuction, I was worried about just the crepey and paper mache, just thinned out excess skin that was there. So I did a direct excision of the skin on the outside and then did a full medial thigh lift altogether. So I was, just very cautious not to be pulling too tight one side and chasing it with the other, trying to keep everything nice and even on both sides. And she's doing great now, a couple months out. And that's always the battle between liposuction and excisions and what we're talking about patients as far as what do you want the final result to be? How much of a gain do you want to get? And if you want to really tighten and change the entire contour, you're looking at scars and incisions, but in the right hands and, with proper education expectations, a lot of times the thigh lifts can be a great option for patients.
Yeah, and thigh lift scars, as much as they're sometimes harder to hide, tend to fade quite nicely. So, the outer thigh, I've done a couple of those. They normally you can end up looking quite good with time. And the inner thighs that kind of run it along the inseam tend to, turn out quite well. So it's really worth the trade-off to really improve those contours and change the shape pretty dramatically.
Yeah, I liked what you mentioned as far as the difference between arms and thighs is that arms is, okay, you can do an arm lift, and that's upper arm, kind of hiding it inside the arm, near the armpit, going from the length of the armpit to the elbow. For thigh lifts, there's, I would say there's like 4 different zones. There's the posterior thigh, and I include the butt with that. And that typically has cellulite or indentations. There's either these transverse or horizontal lines in the back of the thigh or these dimpling across the butt that up to 90% of women have. And there are treatments for that. Both of our offices offer Avali, which is a one-time, potentially in-office local procedure where there's a small incision made typically at the butt crease under local, where those bands, the septate that are connecting the fat to the skin, can be released to help to round out the butt to decrease some of the irregularities and contours of the posterior thigh and the butt. So that would be one compartment. Dan, anything to add to that compartment?
Yeah, Avali's been a cool kind of newer device to really effectively treat those. There's been a number of other attempts at improving cellulite over the years. They've always kind of fallen a little flat, in my opinion, in the long-term results. Besides releasing those bands, Brazilian butt lifts, adding some fat to the butt, to the hip dips can contour that. So it's more of the butt, but that all it transitions. It's kind of a 3-dimensional structure, right? Butt, hip to outer hip, thigh area, really trying to improve that shape is all part of that.
And so the second compartment, I would just say, is the anterior or the front of the thighs. And for me, that's kind of a no-fly zone. I don't really do very much there. I usually try to cheat that or improve that with what I'm doing medially or laterally. Do you do any aggressive or specific treatments for the front of the thighs?
Yeah, I'm not a huge fan of being overly aggressive there. I've seen a lot of patients come from elsewhere where they're had a ton of lipo done and it just looks pretty terrible. And it's really hard to fix. So I tend to like to stay kind of in the medial outer thigh areas when we're trying to improve the overall shape. And you can make pretty dramatic improvements with that. If it's really trying to decrease the overall circumference and bulk, weight losses can be effective, and as everyone carries weight differently. But liposuction there is more prone to contour issues.
Exactly. And then lastly, what we're going to talk about at the brunt of this podcast is just lateral thigh lifts and then medial thigh lifts. And so the lateral thigh typically is patients who, whether it's their DNA, their genetics, they're just kind of predisposed to having that bulkiness that sits more laterally on the outside. We call those the saddlebag areas. And, after weight loss, after weight changes, pregnancies and stuff, there just can be quite a bit of excess fat plus skin in that area. We've talked about lipo only in our liposuction talk in that area, but assuming that there's laxity of skin, there's too much skin and too much fat on the outer thighs, what are your approaches or what are your discussion points with patients who that's predominantly their major concern, their major gripe?
I mean, I honestly, I don't think I've seen a lot of patients that have a lot of loose skin on the outer thighs, unless we're kind of focusing on saddlebag, debulking that, really thinning it out, and then we need to excise that to tighten the skin. So more predominantly, I tend to see the patients with we're trying to pull all that loose skin medially, which tends to be a more favorable scar opinion. Have you seen more patients looking for true lateral thigh excisions?
No, it was just unique that I did that lateral thigh excision in that one patient. Otherwise, I think as plastic surgeons, we're trying to hide scars or at least put them in good positions. And so just that being your workhorse, we're like, oh yeah, I'm going to give you a big scar on the outside of your thigh that's very visible and very, prone to, being exposed, and if you're laying on it and things like that. So I would say that's very unusual, but that's just the third compartment or zone of the thigh that I wanted to hit home with. I typically do lateral thigh liposuction, either with a tummy tuck or with a thigh lift, and then the brunt of the work is going to be done medially. And I think you're right. I think a lot of the laxity ends up being able to be drawn over there where it can be tightened, and then it's just a very convenient way to hide that scar that will fade over time, but at least we're putting it in a position where it's less visible, both early on and then also in the later stages of healing.
Yeah, one thing I think that's often overlooked when we do tummy tucks is that we are lifting up the anterior thigh a little bit. It's normally not going to change the upper knee region, but that transition zone from the tight tummy to the upper thigh does get some tightening. So that's why I don't like to combine tummy tucks with medial thigh lifts, because they're often pulling on each other a little bit. But there are some, you do get some improvement with that upper anterior thigh when you're doing a torsoplasty or tummy tuck or the body lift after weight loss.
What about torsoplasty, belt lipectomy, either, incisions all the way around the body? If you're doing that, how much of an impact does that play on the thighs?
Again, I think it's mostly the upper third of the thigh gets the most pull. Same with the butt. The upper butt tends to be pretty tight. The very bottom of the butt can sometimes still have a little bit of laxity. It looks great right when you're done, but gravity always kind of pulls a little bit. So I always tell patients, the further away you are away from the incision you are, the less pull it has. It's a lot of these different zones of adherence to kind of limit the various pulling effects. So that's kind of in the upper third is the most effect from those lower body lift belt lipectomy procedures. Right. And the same with the lateral thigh, again, for a belt lipectomy, torsoplasty.
And then I just want to talk about the actual procedure, medial thigh lift, what are we actually doing there? And then I think talking about just recovery, what expectations should be early on and what the results, should be to expect. So we're talking about a medial thigh lift. You're scheduling that. You're seeing them maybe in their pre-op visit for pictures and for discussion. What are some of the key points that you want to enforce to the patient?
Yeah, so I always tell patients I start with liposuction to kind of really debulk the area, and it also helps define the plane, very similar to an arm lift. So we want to try to preserve important things like lymphatics and veins and things. So that really helps do that. Mostly targeting the inner area, some again lateral to help just free things up. And then we plan our skin excision, and normally it can often go almost just above the knee to kind of tapering a little bit up in the groin. I don't like to go too high up though, because a lot of important lymphatics there. Some patients are like, I really don't want it to go past here. If they have bike shorts are kind of trendy these days, and those will help hide the scar. So you can keep it shorter. Sometimes it limits how much skin you can remove, but we try to accommodate those different preferences, and I think you can still get big improvements with that. But really, then you're kind of in the marking, pinching, and seeing how much skin you think you remove. mark my anterior line, excise, and kind of go down and pull as much as we can safely in that area. Is that similar to how you approach it? Liposuction and skin excision.
So what are the variations of incisions that you offer patients, or like what would be someone who doesn't have a ton but still needs a thigh lift immediately versus somebody who's lost an absolute ton of weight and has it dragging down to their knees?
Yeah, so if it's not as much, sometimes you can keep it strictly a vertical scar. I'm not a huge fan of like scars just in the groin area. There are kind of, scars that kind of just go up and you're lifting more vertically, again, because of the lymphatic structures, potential issues there, seromas. If there's more skin laxity, you can often do cheat up. It's almost like a little bit of a lazy S, where it curves up a little bit to help pull in more skin. And again, similarly with the arms, I don't like going past the elbow. I don't tend to go past the knee unless we really, need to.
I've had, I think like a straight vertical, I think are more non-massive weight loss patients. So patients who are maybe fluctuated 20, 30 pounds, just have some laxity, just want things tighter. But I would say a majority of patients who are actually very serious who want the thigh lifts, at least in my practice, are the ones who've lost 80, 100 pounds and, they just have a lot of extra bulk. And so, they are very open to lengthening the incision if it's going to just get rid of some of that bulk, because they have laxity in a lot of different areas. For me, it's almost like a hockey stick incision. So, beginning at the knee, trying not to cross the knee joint, trying to debulk a lot of that padding that's there. I'll do some specific liposuction on the inner knee, and then the line goes up, vertically up to the groin area, and then I just extend it with an oblique extension, just to grab some of that extra loose tissue that's there. It's very superficial. It's basically just skin at that point. We're not really doing any lipo or removing any fatty tissue, but I just feel like sometimes it clumps up if I'm trying to keep it all vertical. And so the hockey stick extension is the one technique that I do that has worked really well for patients who have lost a significant amount of weight.
Yeah, that's a better description of it. But I do the same thing essentially, with kind of curving it up a little bit.
And so, they're asleep, for, I think a lot of the risks for thigh lifts are similar to arm lifts. There's bleeding, there's infection, there's wound healing, especially for patients who've had gastric bypass, who've, lost a lot of weight. I certainly want to optimize their nutrition. I'm trying to collaborate with some local experts with that, just to try to provide them with pre-op, post-op nutrition. But I say inevitably there's probably going to be one little spot, or at least one little spot, that may open up, whether it's a stitch that's dissolving, whether there's irritation from the compression garments. And so to expect a little bit of wound care and ointment here or there with a blister or something like that, I've kind of seen it all. So I just kind of prepare them that, we'll get through it together. There can be adhesive allergies. There can be patients who don't tolerate the compression garments, so we sort of need to think outside the box with ACE wraps and different padding. And so we just want to get them through their post-op recovery as smoothly as possible. During surgery, we're of course worried about blood clots, and so we use SCDs or sequential compression devices, where for my patients post-op, I'm getting them up and walking immediately, encouraging them to ambulate. And so we're trying to minimize all of the risks that happen with surgeries, so that it's a very, very small chance. Is there anything else that you tell patients specifically about thigh lifts?
No, I mean, that's kind of spot on. I think it's similar to arms, where it's generally not that painful. I mean, it's sore, it's kind of tight, it feels funny. The biggest headache's probably the compression garments and kind of being a little limited with that, but definitely want you walking a little bit, keeping the blood moving. Tiny little incision problems happen, but normally they're pretty minor. Bigger things are fortunately quite rare, so normally go pretty smooth, and back to doing most of your regular stuff, and really regular daily stuff in probably a few days, but full activity 3-4 weeks. You're doing not 100%, but a lot of it.
Yeah, I'd say reasonable expectations 4 to 6 weeks to get back up to full speed. Perfect case scenario. I'd say usually the first couple of days they may feel like they regret it, or maybe you're second guessing their decision, just because I just feel like the legs are just a little bit harder to rest and elevate as compared to like the arms, where you're just not weight bearing, like to get around. And, as I usually wrap with some gauze and ACE wraps for the first couple of days before they get in their compression garments, they can unravel and then they have to rewrap them. And so I would say getting through the first, 24, 48 hours of just figuring it out, like most post-op surgeries, then they come in walking, a week later, 2 weeks later, and, they start to be really thrilled with their results and say, oh, wow, like, I can't believe this is my thigh. And end up, as I'm talking to them, they're just like staring in the mirror, like back and forth, turning back and forth, like looking at their thighs in astonishment. So it ends up being fun, but to me, I would say that this is not a cakewalk. You have to be expecting some swellings, expecting some pressure, and needing to wear the compression garments as you would for most of the body contouring surgeries that we've talked about.
Yeah, I think a lot of thigh lifts I've done are patients who have done abdominoplasty, torsoplasties on as the first stage. So comparing it to that surgery, it is almost a cakewalk. It's still not as easy as arms, but it's always that abdominoplasty portion that's kind of the biggest of them in terms of the recovery and some of the discomfort.
I've had some patients say that the thighs can be worse. Like if you, we talked about with anesthesia, but like the tap blocks that you do with our Expro long-acting medicine, some of the patients that are, doing the drainless tummy tucks that we do, off of pain meds within a couple of days, I feel like they are getting around and getting into the office at 1 week very smoothly, excited, and feeling good. And sometimes the thigh lifts, like they're just like, man, this is just tight or swollen just because it's a lot of lipo. I would say even more lipo than I do for a tummy tuck on the outer thighs and then pulling it all together. So, I've also had it vice versa, in your category where, they feel like this is no big deal. And, I would say give it a couple of days and then it always evens out and patients are, very happy and relieved that they did it, and certainly looking forward to shorter shorts and tighter pants and feeling good and really being able to work out. And a lot of these patients who've lost weight, they just feel like with chafing, with the loose skin, they just feel like they can't get around and move. It's sweaty, their legs are heavy, and then it's almost like turning these wooden trunks into skinnier limbs and branches that they can move around and just be more agile. And they just feel like their quality of life, their overall health is better because they can just ambulate better. Yeah,
absolutely. Yeah, it really can be pretty liberating surgeries, both arms, thighs, kind of allow those extremities to move like they want them to. Again, incisions like the arms, they take time to fade, but normally, with proper, skin, wound care, incision care, they can often turn out quite nicely.
And when do you tell patients to expect final results following their thigh lifts?
Again, a lot of little swelling can take up to maybe 6 to 7 months. Scars, they'll really take up to 1 year to 2 years to fully fade.
And so, circling it all together as we're rounding out our first season of podcasts, we talked about tummy tucks, we talked about arm lifts last week, now we're talking about thigh lifts. If someone came in and said, hey, I want to do all of the things, I want my whole body restored, I've lost 150 pounds, tell me what order I should do them in. Is there a specific order that you would prefer your patients choose as far as arm lift, breast dog lift, tummy tuck, torsoplasty or thigh lift? Like, what would be your preferred route?
Yeah, I think a lot of it comes down to patient preference. Obviously, we prioritize that, but I think most patients, their abdomen is the main priority. So normally we're doing abdominoplasty or torsoplasty, bellypectomy, whatever you want to call it, kind of removing that circumferential skin with the breast. That tends to be a nice combination. You can do that all pretty efficiently, and even with augpexy or implants with a lift, tummy tuck, all at one time. And then doing arms and thighs as a combo, logistically it can be a little bit annoying for the patients, but that can get you done in 2 surgeries. A lot of times, though, patients do kind of break those up and do 3. That tends to be probably the most common, route I've done. I have done breast reduction, arms first, and then the torsoplasty, and then the thighs. There's a lot of ways you can do it. It really comes down to, again, patient priorities, but I tend to like the tummy tuck with a breast procedure is a pretty dramatic first step and tends to be, in my experience, patients' kind of main concern. What have you seen? Do you have any different
No, I think overall it's the same. I think that in those patients, they're staring at their torso, their abdomen, their breasts, and wanting to choose to do that first. And I would say from my perspective, I agree with that. I think just jumping right into the thighs first, I just feel like it's not the easiest like first leap into body contouring surgery. It's kind of like the legs are wrapped up. It's not as like dramatic, like, oh my gosh, I can see definition in my abs. It's just sort of like it's like it's necessary. But it's almost has more functional gain as it does aesthetic, where it's like, oh wow, I'm like just feel lighter. But I don't see the thighs being like the first procedure oftentimes.
Yeah, I have had a lot of patients who, after do the abdomen and breast, they're feeling really good. They're exercising more. They've lost already 120 pounds, and they lose another 20 just because they're feeling so good. And that it's going to change the thighs more so. So it makes that thigh lift even more dramatic when then they'll lose more weight there. So that can also play a bigger role. So yeah, what else have we? We exhausted thigh lifts, so I guess we could talk about avoli, maybe more detail, different time.
Yeah, I think this was great. Obviously there's surgical, there's non-surgical, there's treatments on the posterior thigh, buttock, as far as avoli and cellulite treatments. There's fat transfers, BBLs, lateral thigh, I would say predominantly liposuction to remove the bulk. Anterior thigh or the front of the thigh, we're not messing with too much. We're using that more, skirting it medially to try to improve the contours. And then the medial thigh lift is some variations, removing skin and fat from the inner thigh. No drains, compression garments, a little bit wobbly for a couple of days, but then really great functional results, aesthetic results, fitting better in clothing. A great procedure to combine with other procedures, either at the same time, but more commonly after maybe a tummy tuck. And thigh lifts are just another way that we offer ways to self-care and healing and restoration and rewards for hard work with weight losses and just getting your body back to where you want it to be, because life is short. So you should have fun and do what you want, right?
That's right. Awesome. Well, do we know what's on doc for the next one, or are we still?
I think we should surprise them. I think we should just drop it. Maybe no promos or anything. Just be like, oh, hey, here's this absolute banger of a podcast.
Find some more guests. I think the guest was fun.
Yeah, we'll get some. There's two others actually that I've invited. I'll tell you about them. So we'll get some extra help here. So Dan, always a pleasure. You have a good rest of the day, and thanks everybody for listening.
Take care. Later.
Thanks so much for tuning into this week's episode of Fuller Butz, a behind-the-scenes plastic surgery podcast. Doctors Fuller and Butz are so appreciative of your time and attention. We invite you to subscribe, share, and continue to enjoy our plastic surgery perspective. Feel free to reach out on Instagram at either @FullerSurgeryMD or @DanielButzMD. That's Butz with a Z, for comments, suggestions, and support. Remember, be artsy, stay scientific, and make life fun. We hope you'll join us again on the next episode of Fuller Butz.